We're joined today by the CEO of Immutep, Mr. Marc Voigt. Now, recently, Bristol Myers Squibb announced its phase 3 trial of Relay has been successful, and its combination with the blockbuster drug Opdivo was helping melanoma patients. Marc, can you tell us about this result and what it means for Immutep's LAG-3 as a promising new therapeutic target?
Yeah, first of all, thank you for having me. Indeed, the Bristol Myers Squibb results have been leading to a great deal of excitement within the industry and within the clinical field. We talk here about a phase 2/3 clinical trial with more than 700 patients in first-line melanoma. Opdivo in combination with relatlimab or Rela versus Opdivo, so versus standard of care. And what we saw in this registration relevant phase 3 clinical trial are statistically significant, clinically meaningful progression-free survival results. We don't know the specific numbers yet. They will be presented at ESCO, so that's beginning of June, so in a few weeks from now. It's the first time actually since 6-7 years that you have a new validated immune checkpoint. So you have CTLA-4, you have PD-1, so blockbuster drugs like Keytruda or Opdivo, and now LAG-3 is emerging as the next validated immune checkpoint. So it's of course very good for melanoma patients. Let's see how the results are looking like, but it seems that there is another option which can be part of existing standard of care. And this principle can be rolled out over a number of different adenocarcinomas and different cancer types. So it's very relevant also for us. I mean, we are, as you can see in the background, we are the LAG-3 company. Everything we do is around LAG-3. We are leading this space. We have the person on board who discovered LAG-3, and it's of course very relevant for our programs as well.
Marc, so following Bristol Myers Squibb's recent announcement, how much interest is there now in developing Immutep's LAG-3 therapeutics, and what does the landscape look like?
Yeah, so there's a great deal of interest in terms of Immutep, has been there also before, simply as we have been announcing good results, for instance, in the last year at ESCO or ESMO or SITC, so at big conferences, clinical conferences or immunotherapy conferences. The landscape for LAG-3 is as follows. First of all, you can talk about two different, distinctly different disease areas. On the one hand side, autoimmune diseases and oncology. We are, together with GlaxoSmithKline, the only company which is active in both fields, autoimmune diseases as well as oncology. We are the only company, including GlaxoSmithKline, so we are really the only player who has 4 different programs around LAG-3, 2 of them in autoimmune diseases. So we exclusively worldwide licensed one of our programs to Glaxo. This is why they play in that field. And 2 in immuno-oncology. And you practically see a number of big players in the field, like our licensee Glaxo, our licensee Novartis, our clinical trial collaboration partner Merck. You see Roche and Boehringer Ingelheim, so different companies. But again, there is no other company having that many different programs, and out of the 4 programs, 3 are unique. So the one we licensed to Glaxo, this is a unique one. IMP761, our preclinical autoimmune asset, is unique. And also eftilagimod, where we published most data, is an entirely unique program, and looking there at the MHC class 2 LAG-3 interaction.
Marc, how does Immutep's FD work, and why does its different mechanism of action matter?
Thank you, Tim. Indeed, eftilagimod alpha, or FD, is a unique MHC class 2 agonist. In other words, it's an immune booster working on the antigen-presenting cells. So relatlimab, also Opdivo or Keytruda are working on the T cells. We are working on the dendritic cells or monocytes, so in other words, on antigen-presenting cells, so different primary target cells. This explains also maybe why we saw so many good effects in combination with anti-PD-1 or in combination with chemotherapy. In a very simple words, the T cells are the soldiers of the immune system, for instance, killing cancer. The antigen presenting cells you can think of as the generals of the immune system, providing the soldiers with the right information whom to attack. Obviously, that's very important. And on the other hand side, also creating via the physiological way more soldiers. So we can measure that in patients, that we create more CD8 T cells, that we create more NK cells, more CD4 cells. So we have a mode of action which matters if you follow the data, if you look on what we are doing, and we are a very, very data-driven company. And the relevance, to come back to the point you made earlier about RELA or relatlimab, the reason why that matters for us is that relatlimab validates the LAG-3 MHC class II interaction. So you have on the one hand side LAG-3 and then the major ligand MHC class II. And of course, this interaction is quite important, and we address practically with our different programs both sides of the interaction, MHC class II, and with our licensee Novartis, LAG-3 directly. So this is why it's different, but also why it matters.
Marc, you're in a very much a results-driven business, particularly with data points. When will you know more about Bristol Myers Squibb's results, as well as the results for Immutep's FD?
Thank you. So we just press released a little while ago that we will present at upcoming ESCO, so the worldwide biggest clinical cancer conference, beginning of June, 4th to 8th of June to be precise. So we will have 3 posters. We will show results in terms of non-small cell lung cancer, in terms of head and neck cancer, and also practically final data from the trial we do together with Pfizer. 12 patients. This will actually be a poster discussion. Bristol Myers Squibb publicly said at their earnings call that they will present at ESCO as well. So ESCO for LAG-3 should be pretty big this year. And they are very, very excited about the results. And we are equally excited about ESCO. Let's see what we are going to present. Let's see what Bristol Myers is going to present, and how this hopefully together builds more excitement for the LAG-3 space.
Marc Voigt, thank you for your time.
Thank you. It was a pleasure.